The Public Safety Committee be called to order. Madam Clerk, please call the roll.
Alderman Boyd. I gotta do yes, Alderman.
Here.
Alderman Vaccaro. Alderman Cone.
Present.
Alderman Arnowitz. Here. Alderwoman Hubbard. Present. Alderman Kotar. Alderwoman Spencer.
Present.
Alderman Muhammad. Alderwoman Boyd. Chairman Kennedy. 7 present. You have a quorum.
We're going to excuse the official chairman of the committee, Alderman Kennedy and Alderwoman Boyd. First board bill up for discussion is Board Bill 241, sponsored by Alderwoman Ingrassia.
Thank you, Mr. Chairman, members of the committee. I appreciate your time on Board Bills 241 and 242. If it's okay, they're companion bills. If it's all right, I'll just sort of discuss what they both do.
Okay.
Thank you. Currently under state law, or I'm sorry, formerly under state law, the city was not allowed to, did not have a mechanism to collect administrative fines that the building division puts on properties when they get code violations. And that law changed at the state level, and so I've been working with the City Councilor's Office Problem Properties Division to determine a way for us to put something in place that allows for us to do that. Administrative fines can be anywhere from $25 for maybe chipping paint or something like that, all the way up to $500. And we will have a mechanism in place pursuant to this bill. The building commissioner will be able to certify the administrative fines, and then after a year, if they are not paid, they can get tacked onto a real estate tax bill. So it gives the city quite a bit more teeth with respect to holding problem property owners to task. And I have Matt Moak and Erica Zaza with the Problem Properties Unit here, if you would like for them to come up and speak more specifically about the legal pieces of it.
Sure.
Okay.
Thank you.
Morning, committee. Thank you.
Good morning. And again, Matt, just remind people what you do, what your position is.
I'm with the City Law Department, and I run problem properties in the City Law Department. Both of these board bills, as the Alderman has alluded to, concern an expansion in state law, allowing us to do a little bit more than we've historically done regarding the collection and enforcement of fines on property. I think most of this committee is familiar with what we've been doing in problem properties for a while regarding expedited foreclosure of demolition, board up bills, debris removals, taking care of properties, services at property, and we've been doing that now for about 10 years. 241 addresses expanding our ability to issue special tax bills for the unpaid building division administrative fines on property beyond what we have historically done in the board up and unsecuring area and with demolition bills. So we would like to go there essentially, and the simplest way to look at it, I think, is to imagine it as the pot of potential monies and fines that we can use to go against bad property owners has expanded, and we'd like to go down that road and see what we can do. 242 is tied into 241, but what the state law has allowed us to do, in addition to using special tax bills for these administrative building fines, is they've also gone a little further and authorized us to go directly to the real estate tax bill itself without having the formality of the special tax bill process included. Practically speaking, we're not sure how we're going to implement that necessarily. We'll probably start out using the special tax bill process to get going on this. But again, it gives us an additional tool and takes a little bit of the bureaucratic process away, which opens up more opportunity for us.
Yeah, the only thing I would add, just a further explanation of 242, the administrative fine ordinance has been in place for about 10 years. So there have been a lot of fines that have been amassing over the course of those years. For the ones that have not been paid, we've been filing judgment liens against those properties, which allows us essentially when the property sells or moves, we collect the money. This process puts that more on the front end, that when the fines are being accumulating, we can go after them earlier in the process to try to collect some of those money against the people who, a lot of the property owners who aren't paying their fines, they're not showing up in court, and at this point, they're just sitting out there. So this is just a tool to hopefully get some money from the bad folks that aren't maintaining their properties.
Okay, and tell us who you are.
Oh, I'm sorry, Eric Azaza with City Councilor's Office.
Okay, thank you. We'll go ahead and take questions from the committee. Alderman Vaccaro. It's not up here, okay. Alderman Cone.
I actually don't have any questions. I worked with one of our state reps to actually get the law changed in Jefferson City so that we could do this. So happy to see that we're implementing it locally. That's awesome.
Alderman Arnowitz.
Good morning. Matt and Erica. So is this kind of, so I'm probably thinking of something else. So these are fines that haven't been collected, it's been assessed once they've been to court and hasn't done the work on their properties?
Not quite. These are actually, there's a whole separate, there's fines that are assessed in court, but the building division also assesses administrative fines. So that's something that if they have code violations, they get a violation notice. The inspectors can either put them in court or they can just assess a fine, which is normally $25 per violation. After so much time, they double. Property owners can appeal those fines. There's different things they can do, but if they don't appeal them and they don't pay them, then it would fall under this, they're subject to being put on the tax bill, or a special tax bill would be issued.
Okay, and we have probably a lot of unpaid fines out there, I'm sure.
There's quite a bit out there, yes.
Okay, thank you.
Alderwoman Hubbard.
No.
Alderwoman Spencer.
Thank you, Mr. Chairman. So if I understand correctly, this is not expanding what we are able to kind of, what constitutes a violation. In other words, what currently, if you have an unsecured building or your cornice is falling off or those sorts of things, the violations themselves will remain exactly as they are. Am I understanding that correctly? Correct. And what we're doing is allowing any issued violations to be attached to the tax bill for essentially more teeth, as the Alderwoman described, and a quicker ability from the city to be able to collect those funds.
That's
Okay.
generally accurate. It's not tied so much to the violations as the ability now to take fines that we previously couldn't get on
Sure.
the tax bill.
And put them on the tax bill. And then the second bill is simply just to allow for that, to make sure, to do that without a special tax.
Yeah.
Yeah, the
It
tax.
gives us, second bill gives us some options there, and that's what we want to keep ourselves free to do.
And we,
Approach property as we see fit.
and we have no fiscal note because we're not expanding what we're currently able to issue as fines, but simply expediting the process and making it making it less easy for an owner to continue to have outstanding violations.
I think it'll allow us to put pressure on bad owners and landlords that we weren't able to do before, of course. And it's not all about collection. We do collect money, of course,
Sure.
and we will here, but it's more about pushing a property off the status quo, which of course is our mandate in
Sure.
problem properties.
Being able to enforce current building codes. But this should have a positive fiscal impact. If anything, it wouldn't be a negative fiscal impact on the city. It's making these processes go faster.
And Alderwoman Ingrassia included in the board bill a possible provision, another second one, 242, that might allow to expansion of resources to try to get to these fines, and it should have a positive impact, but we may need a resource or two to get there.
Sure.
And then also the idea is if we can make collections in this area, that it might be signed to a special fund and tracked, and, you know, the different things that go along with that.
And what is that provision in Board Bill 242 that does that?
Subsection D on page 3.
Can you describe that one more time?
It's just allowing that the funds that are collected under this ordinance would go into a special funds that could be sort of tracked and that would go into the control of the building division, I believe.
And do we anticipate having to hire anybody, as you mentioned?
I think not in the first year.
what we
Yeah,
talked
I mean,
about.
we want to get started with it, Alderwoman Spencer, but I think the feeling is if we do as well with this as we think we can, we might need an additional attorney or perhaps a support staff to move this along. And we made that a part of the fiscal note on the bill.
Okay. I have to say, this is, building code enforcement is one of the issues our city struggles with. We have a lot of vacant, dilapidated buildings that continue to be ongoing issues for years, if not decades. And giving the city more teeth to be able to address some of those is a very, very good thing. I think this will have a very positive impact on the neighborhoods I represent and the city as a whole. So thank you for doing this, and I appreciate, I'm glad to be a co-sponsor and look forward to the passage of this.
Alderman Muhammad, you have any questions on Board Bill 241? No, sir, Mr. Chairman. Alderman Vaccaro.
No.
Oh,
Hey, guys.
Hey, guys. Hey, Joe.
I call Erica a lot. She's our prosecutor.
okay. I would also like to be a co-sponsor on 241, and I will entertain a motion on 241 at this time.
I'll make a motion that we pass 241 out with a due pass recommendation.
Second.
And you can throw my name on it.
It's been moved in second. Madam Clerk, please call the roll.
Alderman Vaccaro.
Aye.
Alderman Cone.
Aye.
Alderman Arnowitz.
Aye.
Alderwoman Hubbard. Alderman Kotar. Alderwoman Spencer.
Aye.
Alderman Muhammad. Alderwoman Boyd. Chairman Kennedy. Vice Chairman Boyd.
Aye.
7 aye votes to pass.
Now what's before us, Board Bill 242. I'll entertain a motion on 242.
Make a motion that we pass Board Bill 242 out with a due pass recommendation.
Second.
Wait a minute, what's 242? Hang on a
It's
second.
the companion bill to 241.
I just, yeah. I was like, because I guess I didn't, yeah, I'm fine with that.
It's been moved in second. I'll request previous roll. Hearing no objection to previous roll, Board Bill 242 comes out of committee with a due pass recommendation. Next board bill before us is Board Bill 34, sponsored by Alderwoman Ingrassia.
Thank you, Mr. Chairman, members of the committee. I appreciate your time on this bill this morning. Aligning with national trends and based on previous testimony here at the board, issues occurring at the Planned Parenthood Clinic on Forest Park Parkway needing police department attention are on the rise. In 2015, there were 38 calls for service. In 2016, the SLMPD received 66 calls for service, and last year, 73 calls were made. A large percentage of these calls were for impeding the flow of traffic and peace disturbances. Oftentimes, traffic issues at the driveway at Planned Parenthood pour over from the driveway, creating additional public safety concerns for unsuspecting motorists and pedestrians having no affiliation with the clinic or those demonstrating there. In addition, this committee has received documents and heard testimony from both supporters and opponents of this bill that demonstrations in front of Planned Parenthood can impede access to the clinic and are many times confrontational. It is now common practice to provide escorts for those entering and leaving the clinic to ensure access and to provide protection from aggressive counselors who sometimes use strong and abusive language. Demonstrators impersonate Planned Parenthood employees, wearing vests and utilizing check-in here signs. It is not unheard of for street counselors to reach into people's cars in the driveway. Unfortunately, the police department has testified the current laws we have in place are not able to address these concerns. The United States Supreme Court has held that it is a traditional exercise of the state's police powers to protect the health and safety of their citizens. Furthermore, that interest may justify a special focus on unimpeded access to healthcare facilities and the avoidance of potential trauma to patients associated with confrontational protests and protect listeners from unwanted communication. This board will accomplish just that. Working with a wide variety of stakeholders from the ACLU and Black Lives Matter activists to unions and attorneys, we have narrowly tailored this legislation to serve St. Louis City's significant and legitimate governmental interests and left open ample alternative communication channels for demonstrators. This 8-foot buffer will serve as a bright line rule ensuring everyone in the area knows exactly where they are allowed and not allowed to be. Buffer zones have been proven to be effective. According to a 2013 survey by the National Abortion Foundation, over half of clinics with a buffer zone in place have experienced a decrease in criminal activity. Over half of clinics with a buffer zone in place say their safety concerns have been reduced, and 75% of clinics with the buffer zone in place say that it has improved ease and patient of staff access to the clinic. I am happy to take questions.
Okay, Alderman Vaccaro.
Sure. So during the protests that went on, how many calls for police service?
I don't know which protests.
The ones that were going on over the Stockley verdict. There was a lot of protests going on, and there was a lot of calls for police service during that.
Yeah, that's obviously, I don't have the numbers for that. This is an
Probably
issue with specificity to the Planned Parenthood clinic.
Probably more than this, but, and I know that you're part of another bill that wants to make sure people have the right to protest and have their voices heard, and to block streets and do any of that. But then this bill counters all that and says, well, everything that I believe in my rights should be held. But things that I don't believe in, I think that their rights shouldn't count. So.
I don't know what board bill you're referring to that I'm a part of that.
Well, my understanding, well, it's the board bill that Megan's got together. I thought you were a co-sponsor on
I'm
it.
not a co-sponsor on that bill. I will also say that I understand your concerns. Demonstration and First Amendment rights are very important. That's why we worked with the ACLU, Black Lives Matter activists, Fight for 15 folks, and unions to make sure that this is only for addressing a specific issue. We've balanced with learning lessons from the United States Supreme Court decisions that were struck down and upheld to make sure that we have a legal standing to protect patients' rights.
So if this were to pass through and a large group decide to protest and block streets and lay down in the streets, you would support that?
I don't have a bill in front of me that would give me the information I would need to support or not support that.
Well, this is, whether you're pro-life, pro-choice, this is about people's right to be able to have an expression of how they feel. Now,
This is a bill about public safety.
well, then, we made a buffer zone after the Stockley case. If you remember, it was across City Hall in that park, but nobody stayed in it. So is your intention to start arresting people out there that are out there basically expressing their...
There's no arrest provision, it's a citation.
So we're doing a bill that, so we're going to tell them, oh, you're not supposed to do that, but there's no penalties?
There is a provision for one warning in the board bill.
Then there is penalties.
I didn't say
What
there weren't
happens on the
penalties.
second time?
Correct.
Anyway, anyway, I have great issues when we start messing with people's right to express how they feel.
Alderman Cone.
Thank you, Alderwoman, for your thoughtfulness in regards to this bill. So, to address some of the concerns that I've heard, does this bill prevent anyone from protesting in front of Planned Parenthood?
No.
To address the buffer zone and right to free speech in other parts of the city, does this prevent people from doing so in any other part of the city?
No.
So, from an administrative perspective, and I see a representative from Planned Parenthood here, is the idea to basically paint a line, for lack of a better idea or concept without hearing directly from the organization, but the idea is to basically paint an 8-foot line outside of the driveway.
Right, demarcation is actually a required provision of the board
So people
bill.
who are protesting clearly know where they're not supposed to be, but still provides them ample opportunity to protest everywhere around the clinic, with the exception of the driveway, which is a public safety concern, which there are frequent phone calls into the police department about this, very frequent phone
That's
calls into
accurate.
the police department, to the point where the police department is exceptionally frustrated with the number of phone calls that come in.
And the number may be
regarding-
higher. Officer Kavanaugh, who testified before us the last time we were hearing this board bill, mentioned that he gives out his personal cell phone number to people, so that there are likely more calls that are not reflected in the numbers from the
That
police
are not
department.
reported because they're going to a cell phone instead of to 911.
Right.
Correct. So, you know, I know that there's some concerns around, you know, people's First Amendment rights, but people still have their First Amendment right to protest in front of the clinic.
They absolutely do, and the United States Supreme Court has been very clear that there is a balance here. It's not just about First Amendment rights, it's also about
Public
access,
safety.
public safety, access to health care, and unwilling listeners.
Thank you. That's all the questions that I have.
Alderman Ornowitz.
Thank you, Mr. Chairman. So, Alderwoman, so help me out here. So, I've never been there. So from what I'm hearing and understanding, so you're saying it come down the street on Euclid and there's a turn to go into a parking garage?
Not Euclid, Forest Park
Or
Parkway.
Forest Park Parkway. See, I'm from South St. Louis. So they turn and go into a parking garage. So
Parking lot.
parking lot, garage. So what you're saying is, so the calls are because of people are blocking people from going into there?
Oftentimes, there are people who are stationed in the middle of the driveway itself, but there are also folks, as I mentioned earlier, that wear orange or green vests and sit literally at the edge of the driveway with check-in here signs, so it's very deceptive with respect to people coming in and out. They think that the people who are looking like they work at Planned Parenthood are employees of that clinic, when in fact they are demonstrators.
And where is the other places? So the idea of the so-called, I hate the word protesters, so wanting to give informational pamphlets out, I guess we'll call it. So where are they normally supposed to be? I mean,
Right now, they're able to be wherever they want, because there's nothing in place that tells them not to be in the middle of the driveway or reaching into someone's car.
So if you have an 8-foot buffer zone, so that takes everybody out of the driveway area?
That's
I'm
correct.
guessing?
So that people will still be able, folks who are entering and exiting the clinic will still be able to hear if there's a street counselor who, wants to get their attention, and have the opportunity to hand out literature. They just won't be able to approach someone with immediacy. And that is the language that we've used from the previous Supreme Court decisions to make sure that we can withstand a legal challenge on this.
So if a counselor's 8 foot away, so how do they get their attention as they're walking out of a car after they park, or as they're
They
going
can still do
in?
it as the cars enter and exit the driveway. They just can't approach the car.
But if it's a cold winter day and your windows are up, it might be hard to hear. I'm just saying, I'm just asking.
Sure.
I
Well,
really
yeah,
don't know.
obviously, if your windows are up, it's a little more difficult to hear someone, but they will still be standing right in that immediate area. So I'm pretty sure if you're looking around, you'd be able to tell that somebody was trying to get your attention.
And I guess we haven't heard actual testimony since, I guess it's been over a year.
We were
from
here in
Officer
June.
Kavanaugh, is that who it was?
Right, and I did check in with the new police chief to make sure. He testified on this board bill previously as well, and he stands by his previous testimony.
The previous police chief?
No, the previous testimony of former Major Hayden. I checked in with the new police chief to make sure that he was still okay with his testimony.
When, I'm not trying to be facetious, but when did he testify?
He testified when it was Board Bill 292, and
Oh, okay.
Right, I can't remember the date.
Okay. All right. So, in your opinion, you don't feel that by having a buffer zone that it impedes people trying to offer people help or give them pamphlets or ask them to come to counseling at all?
No, I don't believe so. And I've spent a lot of time researching and talking to stakeholders and people who have worked on this issue before. I feel very confident in the balance between the patient's rights and First Amendment rights of the street counselors.
One last question.
Sure.
So instead of an 8-foot buffer zone, and I don't know how wide the driveway is, it's probably pretty wide. So that buffer zone would put you at the edge of the sidewalk, I guess, on each end?
Yeah, you would be 8 feet back from the either side of the driveway and on the street. And we did work with the city councilor's office, and the former attorney for the board felt like we could go with a larger circle around the driveway. And we looked at, the Colorado law is 8 feet, so we just decided to go with that number.
Okay, thank you.
Alderwoman Hubbard.
Thank you, Mr. Chairman. I don't have a question, but I just have a brief comment to just exemplify why I support this bill. Some years back, I had taken a friend to Planned Parenthood, and the harassment that she received and just the whole experience was traumatic. And for someone to be just ostracized and made to feel like nothing while trying to get medical attention, that's something that I feel no one should have to endure regardless of what side of the issue you are on. So I'm definitely in support of this bill, and I respect people's rights to be able to protest or feel however they should feel about it. But it was just an experience that I would never forget, and it's something that I think we should definitely get a handle on, because it was very unfortunate for her.
I appreciate that, and you can tell from the escort reports in your packet that it's well documented over quite a long period that there are some troubling things happening. I've seen it firsthand, and obviously you have as well, and there is research that, you know, shows that the traumatic experience of something like that is detrimental to women.
Alderwoman, is that it? Okay. Alderman Coder.
No questions.
Excuse me, do we get to have any expression of our opinion here, or are we just gonna vote on something without even knowing the other side of the story?
Okay, ma'am, we've had public testimony a couple of times already, so today we're not taking public testimony.
I'd like to ask the alderman what she means by 8-foot buffer, in which direction?
I think that may get addressed.
I'm sorry?
I think that's going to get addressed, so just hold tight. Okay. Alderwoman Spencer.
Mr. Chairman, I have no further questions.
Alderman Muhammad.
Thank you, Mr. Chairman. Alderwoman, if you could, just real briefly, if I am a young lady going to Planned Parenthood to get an abortion, can you paint the picture for me? What does that look like when I'm walking in or I'm going past that driveway?
It would depend if you were walking or driving, but frequently there are demonstrators that stand in the middle of the driveway or walk back and forth from sidewalk to sidewalk through the driveway. There are demonstrators who reach into cars and try to give people pamphlets. A lot of abusive language that can be very traumatic for people. And then, of course, the deception with respect to the folks who are dressed up like they're employees or someone who they need to check in with. They actually have a sign that says check in here.
Okay, so now is this a continuance? Like, does this happen every day? I mean, I've been to Planned Parenthood and I've actually watched advocates on both sides, and I didn't see any real confrontation or any real, no real clashing. Maybe some high energy, but nothing
Right.
too
If high
excessive.
energy was the only thing that was happening, I would not be here today. To Alderman Hubbard's point and my personal experiences, the escort reports and the opinion of the police officers, there's an issue, a public safety issue.
Right. So, with Board Bill 34, do you think that we are setting the atmosphere where we're saying protests or demonstrations are not welcome in the city? Because I can recall.
Absolutely not.
I recall back during Ferguson, We had pamphlets, and as we were on West Florissant, we're throwing them into cars too, and people didn't want to take them. But we still did it because we had a message we wanted to get out. So I just wonder, are we creating the atmosphere, are we saying?
I don't think so, no. This is with specificity to balance a patient's right to access health care, which has been upheld by the Supreme Court with respect to also honoring First Amendment rights.
The Supreme Court, are you talking about the FACE Act?
No, I'm talking about there's a number of decisions that the Supreme Court has weighed in on buffer zones. There's Hill versus Colorado, McCullen, and I know the FACE Act that you're referring to is federal legislation, but it has to be enforced by the federal government, and that has not happened anywhere that I've been able to find to date. It also doesn't address with immediacy. It's sort of a recovery mechanism after the fact.
And now, there have been other cities or other areas that have enacted buffer zones or bubble zones, right?
Yes, and that's provided for you in your packet.
Yeah, so I got that, but the question following that is, has there been any major backlash of these cities enacting this type of laws or ordinance?
Can you explain what you mean by backlash?
Has there been any problems after the passage of such laws?
The research I found stated that over half of the clinics reported a decrease in criminal activity in calls for service.
Okay. I would find it tedious and difficult for a young lady who is going through certain situations or social, economical circumstance that forces her to get an abortion or forces her to these type of benefits or alternatives. And I would find it disappointing if she is having to contemplate this, walking into a health center, and there's a screaming mob at her. I would find that disappointing and disgusting. But I don't know if we have actually seen this in St. Louis, or at least I haven't.
That's why I made sure that we looked at the police calls for service, talked to the police who were responding to those calls, and then looked at the escort reports so that we have evidence, because anecdotally, I mean, you can drive past there, sometimes there's an issue and sometimes there's not, but more times than not, there are problems.
No further questions, Mr. Chairman.
Okay. Alderman Cone.
Thank you. You know, I'm going to take a point of personal privilege here for a minute. So some of my colleagues have addressed the concerns of women seeking services for, you know, reproductive medical health issues, reasons, whatnot. I have also been a patient of Planned Parenthood. You know, a majority, you know, well over 90% of Planned Parenthood's business is actually not abortions, to be clear. So, you know, they are, in fact, a healthcare provider. And as such, you know, and as a patient of that healthcare provider, you know, which I have done regular STI screenings and other, you know, services there, I have been approached as I'm, you know, driving into their facility. The way the facility is set up, for those of you that aren't familiar with it, it's right at the corner of Forest Park Parkway and Boyle. There's only one point of egress in and out of the parking lot. The parking lot is fenced off with about a 6 or 8 foot privacy fence. It's actually a wrought iron fence that has a decorative wrapping on it, a screen, if you will, to try and shield the privacy of patients, because there have been issues with people photographing patients and trying to track them down. There's been issues with people who literally put a folding sign in the middle of the driveway that says check-in. So these are not employees of the organization. They are not any way affiliated with the organization, but there's a sign, and they're wearing, you know, yellow vests or orange vests, and they will say, you know, check in here, to redirect them to another vehicle that's parked across the street or down the street, that supposedly provides screening services and consultation to patients of Planned Parenthood. That being said, that fence, that sidewalk in front of the organization, you have fence on both and frontage in front of the facility, both on Boyle and on Forest Park Parkway. I would venture to guess that there's probably about 200 feet of space on Boyle and another 200 feet of space on Forest Park Parkway. Probably actually more so on Forest Park Parkway because the building is actually on Forest Park Parkway as well, so you can technically include that as part of the area in front of the facility. So, roughly about 400 feet of space on Forest Park Parkway. So you're talking about a total of 600 feet of space for people to demonstrate. And this board bill is literally saying that 8 feet in either direction of the driveway, you are not able to protest within for public safety concerns. I personally feel, that is a reasonable expectation to provide for both the opportunity for folks to demonstrate and share their concerns, voice their opinions, and share their beliefs, while also providing, patients, staff, administrators, anyone, other healthcare providers that visit the facility, the opportunity to enter and exit in a peaceful and safe environment. So I have to speak, to provide some perspective for folks. This is not in any way limiting anyone's ability to protest. You are more than welcome to still protest on the other 300 feet of space in front of that facility. You are more than welcome to do so. Please do so. And actually, for those, it was brought up, whether or not there's confrontations in front of the facility. There's actually policies in place on the part of the facility for staff to not engage with protesters outside of the facility. So there's a reason why there aren't, massive clashes between demonstrators and patients and staff. The facility and the organization itself really tries its best to protect the safety and welfare of its patients and its staff and anyone who's visiting. So, that being said, I'm not trying to label any individuals or organizations as hateful or, violent. That's certainly not, my intention. I believe that many people on both sides come to this situation in their own rational manner and 90% of the time in a very peaceful manner. But there are certain extremes that happen that cause issues that are clearly documented. I mean, this is not something that is not underneath the radar at all. So I applaud the alderwoman from the 6th Ward and bringing this to our attention, and I look forward to supporting it here in committee and on the floor of the Board of Aldermen.
Thank you.
Alderwoman Spencer.
Thank you, Mr. Chairman. I simply wanted to reiterate the fact that this is not just about abortions. At a time where health care in our country has continued to skyrocket, Planned Parenthood continues to provide a low-cost, low barrier to entry form of just general health. They are a general health provider. I myself relied on Planned Parenthood as my primary caregiver throughout my entire 4 years at university because I had no other option that I could afford while I was also paying for school. And during that time, I was lucky enough to have that care because something very serious was identified and was subsequently taken care of. And I'm very, very grateful that I had that service. And without Planned Parenthood, I may not even be here today. So I want to remind everybody that Planned Parenthood does serve a purpose, a very good purpose in our society. Again, many people in our city cannot afford to go to a general doctor and have access to different health care, and we should be grateful that there is somebody out there that is providing that service of just general month-to-month annual exams and a health provider that is there every day and serving some of our most vulnerable citizens. So thank you again for sponsoring this, and that's all I have, Mr. Chairman.
Okay, Alderman, let me ask you a question. I'm sorry. Go ahead, Alderman Vaccaro.
I just want to somewhat respond, that I know of, and including both your cases, you've not ever been denied access. You don't like what people say going in. I've been out there, and I haven't witnessed all this. I've been out there with both Timothy Lutheran Church and with St. Joan of Arc, and just, actually, we stood across the street, but it doesn't matter. We were out there just with very prayerful service. But this isn't about, that I know of, no one's been denied access. They may not like the message that someone's sending going in, but no one's been denied access. And taking the whole abortion thing out, I still strongly believe, even when other protests were going on, I strongly believe, whether you like the message or you don't like the message, that protests give us the right to be able to say what we want to say. Now, I stood out there very silent, but I can tell you, when I was out there, and I've been out there, I've never seen all this. But again, I've never seen anybody be blocked from not being able to get access to health care. And I just wanted, since we're doing personal stories, I thought I'd throw it in.
Okay, Alderwoman, talk to me about the enforcement. How will this bill stop people from participating in those activities? Because my first thought is, whether there's a zone or not, if emotions are high, people are going to do what they do, and then you call the police.
Sure.
So how's it really going to stop the calls for services or minimize?
Well, I think the report that I mentioned before, the evidence that other clinics have reported subsequent to instituting buffer zone bills, it has decreased because people have a bright line demarcation with respect to where they are allowed to be and not to be, and I think most people will honor that. If calls for service occur and people are issued tickets, I'm assuming that will deter their behavior the next time. And aside from the police just responding immediately to calls, one of the problems they have now at Planned Parenthood is the police will come and review tapes of incidences if they're not able to respond in time, and they have no way of telling what actually happened. And so having the bright line demarcation will allow for the police to determine what happened and react subsequent to the event happening.
Okay, so let's talk about the line. So where's the starting point to draw the line? And is it just a horizontal line? Is it
It would go
a circular?
8 feet, 8 feet around the driveway, and the board bill would require the healthcare facilities to consult with law enforcement to make sure that they are placing the buffer correctly.
Okay. I was just thinking about people that drive in versus those who walk in. So I could see the logic in a buffer zone if people are driving in, but how does it help those who are walking in?
Well, they would still be offered the same protections as a vehicle entering
Right,
and
but
exiting.
as the alderman from the 25th Ward said, you have all this footage, right? So people are going to walk from Boyle, they have to get to the driveway so people can still talk to them or interact with them. Right?
I don't think I understand the question.
I'm trying to make sure I'm clear on the buffer zone. So the buffer zone is helpful if you're driving in the driveway, right? If you're coming into the driveway because it's saying, hey, look, let's not block the driveway.
Right, but it has the same effect if you're walking in or out of the facility as well.
Right, so, but people can talk to you up until you get to that line, right? Correct.
Yes.
So it's not helping those who are walking in, it's only helping those who are driving in.
We looked at doing a floating buffer, which is what some other places have done, so it's within 25 feet of a person before they're within the buffer. It just, legally to enforce that, it would be nearly impossible. And fortunately, most of the patients are coming to the facility in a car.
Okay. I think it's important that, people vote based on their life experiences. Legislation is created based on life experiences. This is certainly a very tough subject that creates a lot of emotions. I looked at this bill and processed it in a way that, how can I make sure that I'm being fair and just in the decision I have to make? So I tried to take the extra steps. The last time we had a meeting, I went to Planned Parenthood. I went inside to speak to the executive director who wasn't there, but I left a message because I wanted to see if I can review some footage. Because I did ask if it could be uploaded on YouTube so I can, get a chance to take a look at it, because trying to get there on this day or that day, maybe it occurs, maybe it's not occurring. But I was never contacted after leaving that information. And so I decided I would just observe, what's going on. It was a nice sunny day, so it was during the week. And there were, I guess, the counselor is the people that wants to give the pamphlet, right? I want to make
Right.
sure I have my terminology right. Okay, so there were counselors on the sidewalk. And I actually walked in, no one said a word to me. I had some sweatpants on and an Army t-shirt. I came back out. And so I started to engage the counselors in conversation. One of the things I noticed that they were blocking the sidewalk. And not that it might have been intentional, but what I said to them was, first of all, what are you doing? They explained to me what their roles were. And I said, well, do you realize you're actually blocking the sidewalk? And I've watched people have to go around you in order to just go down the street. And so they were like, oh, didn't realize that, right? Because I'm about teachable moments. And so as I stood there, and I probably spent a half an hour out there, there were a couple employees that came out. It was an older Caucasian woman and a middle-aged African-American woman. And it was a nice sunny day, and I was like, hey, hello, ladies. And they just walked right past me as if I was invisible. And I thought, that's interesting. So I'll kind of find out what this is about. So I kind of jogged down to them, and I was like, hey, ladies, how you doing? I was just wanting to ask you a question. Why is it when I spoke to you, you didn't speak back? And so they said, well, when I said, by the way, I'm Alderman Jeffrey Boyd, because I didn't want this to be an intimidating conversation. I said, well, I know who you are. That's what the African-American woman said. Well, you need to understand, just like they do, we don't have to speak. And I thought, well, you're probably right. You don't have to speak, but just out of courtesy and respect and communicating with people and bringing down animosity, it might be helpful. So I just thought, for me, that was a bad experience, because I'm someone that's trying to be objective and get both sides. So I didn't get communication from Planned Parenthood, from the director. I thought I was disrespected by the staff because I presented no harm. I didn't try to hand out a pamphlet or any of that. And I thought that was very unfortunate, because I want to make sure that I'm doing my due diligence before I make my decision. I didn't want to make it personal. And so I just want to bring that out there. And through some testimony that I've heard and even listened to my colleagues, it sounds like it depends on what day you go. You can go this day, everything seems to be peaceful and calm, and you can go a different day and things could be potentially chaos. And I'm just wondering, in trying to pass legislation like this, do we open Pandora's box to corporations and other people saying that they want to do the same because they don't like protesters coming around their premises or whatever? So it's a challenge to me to, quite honestly, to support the bill. I'm not going to be an obstructionist, in the bill, but, I've had my life experience as well, and we all can sit here for the next 2 days and talk about life experiences, and we're not going to do that. But you also have a committee substitute, is that correct?
Right. It should have been emailed to you by Alderman Kennedy last week.
Yeah, and all committee members should have the committee substitute before them, is that correct?
I just had one question about the enforcement.
Okay. So I'm going to yield to.
Can I make a motion to introduce committee substitute, Board Bill 32 for committee substitute?
Give me a second. Sure.
Okay.
Just give me a second. I'm going to yield to Alderwoman Spencer. She had a follow-up question.
Thank you, Mr. Chairman. I just had a question about how this will functionally work. It's my understanding that this bill will not prevent protesters from talking to patients coming in and out, but rather will prevent them from stopping cars and stopping people, therefore allowing that traffic to flow. So is my understanding correct that it's not preventing protesters from speaking to people, but it is rather preventing them from, obstructing them from moving forward.
That's correct.
Thank you.
Okay, I'm going to recognize Alderman Cone.
I'd like to make a motion that we accept Board Bill 34 committee substitute before the committee.
To accept, or you want us to put it before us for discussion?
Or put it before us for discussion.
Okay, so the motion is that Board Bill 34 committee substitute be put before us for discussion.
Second.
And it's been second. Madam Clerk, please call the roll.
Alderman Vaccaro,
No.
Alderman Cone,
Aye.
Alderman Arnowitz. Alderwoman Hubbard. Alderman Kotar. Alderwoman Spencer.
Aye.
Alderman Muhammad. Alderwoman Boyd. Chairman Kennedy. Vice Chairman Boyd.
Aye.
6 aye votes, 1 no vote.
Okay, Alderwoman Ingrassia, can you walk us through the change in the substitute? I'm not sure if is it posted online so the public have access to it?
It's supposed, it's,
Point of order, Mr. Chairman. This is,
Mr. Drury, first of all, I think that's in order. Where's Terrence? No, I would like copies. If the public wants copies of the committee substitute, they shall have them. So we need to make sure we have copies for the public. Okay. So we will get copies for the public.
They are posted online 24 hours in advance of our meetings, at least.
That's not my understanding. The clerk is telling me it was not.
Well, then we can't vote on it.
So go ahead, Alderwoman. Talk us through the committee substitute.
there aren't very many substantive changes. It just tightens up the language. We added language we thought that would be more constitutionally sound, and really sort of focusing on not the prohibitions, but what you are allowed to do, and then some of the reasons why we thought this legislation was important.
Okay, but just do us a favor. Just kind of walk us through page by page so that we're clear and we're following you.
So on line 12, page 1, the whereas clause is discussing the current ordinance and how it has not been effective with respect to addressing traffic problems. Discussing the police department's calls for service and testimony that there is an issue at Planned Parenthood. Then line 6, page 2, discussing the fact that the limited buffer zone will ensure unimpeded access to the healthcare facility and also ensure First Amendment rights are protected. Page 3B just rewords the 8-foot buffer zone.
And what exactly, why did you have to reword it? Talk a little bit about that, because that's actually part of the ordinance outside the whereas. So why did you need to reword it in that way?
We worked with Planned Parenthood and the City Councilor's office, and in fact, this was distributed to the members of the committee at the last hearing, but Alderman Kennedy, we just didn't have it before us. So it was decided quite a long time, excuse me, quite a long time ago.
I mean, the language is more technically sound?
Yes.
Okay.
Page 4, line 12, I'm sorry, line 10, we define driveway. We add a provision on page 5, line 2, for the citation with a warning instead of just a ticket. And then page 5, line 16, we added this language about not conflicting with other federal or state law, so that the unions felt confident that even though they're protected under the under federal law, that they would still be allowed to picket. And those are the changes.
Let me ask you, on page 4, line D, you took that completely out of section 1.
Okay.
Did you rewrite that somewhere, or did you just,
I don't, can you, which line on page 4?
16? Demonstration activity means,
No, we struck that.
okay. So what was your intent originally when you had it in the bill?
That we thought it, determining or with specificity that it would be more legally sound, and then when we had further conversations, that changed. There were a lot of stakeholders at the table subsequent to this board bill originally being introduced. As I mentioned before, the ACLU, Black Lives Matter, Fight for 15, unions, attorneys from NARAL and Planned Parenthood, and then our own legal counsel at City Hall. And so the conversations were ongoing subsequent to the initial introduction.
Okay, let's go around and take questions on the committee substitute. Alderman Vaccaro. No question. Alderman Cone. Alderman Arnowitz.
I don't have none this time, Mr. Chair.
Alderwoman Hubbard.
No question.
Kotar. Alderwoman Spencer.
No questions.
Alderman Muhammad. Alderman Boyd. 2, 3, 4. We need 5, 4, 4.
It's 5 on the committee. It's 10 on the committee.
No, it's the, but we need 8, 5. It's 8 present. We need 5, 4, 4.
Okay, yeah.
Okay.
One more than half.
Okay, you want to go ahead and close, Alderwoman?
Sure. Again, thank you for your time. I appreciate everyone's thoughts and opinions on the matter. This bill is about addressing public safety and protecting patients' right to access health care. And I request your favorable consideration on Board Bill 34, Committee Substitute.
Okay, I'll entertain a motion on Board Bill 34, Committee Substitute.
I move that, point of order, Mr. Chairman.
Point of order. Okay, Mr. Drury, everyone will get a copy of the substitute, okay, but there will be no public testimony, okay?
I do appreciate that this committee has taken a lot of public testimony over the year.
For the chair. I'm Mark Dunn. I'm a member of the Respect Life also for the Archdiocese of St. Louis.
I have the,
Question, I have a point of order.
You don't
you
get
don't
to
get
have
a point of order.
sir.
I have a point of,
I'd like to ask, is the record from the prior hearings going to be incorporated in this hearing? There was over 30 people that testified previously. I think it was last summer in June, you said. I want to make sure that the record reflects that there's over 30 people on this side of the room, and there's 10 or 15 people on this side of the room here today against this bill. And prior in last summer, there was over a large number of people that testified. I want to make sure that the chair and this committee confirms that all that testimony is going to be incorporated into the record of this bill.
Sir, all the testimony is online. These proceedings are videotaped, so anyone who testified, their statement is online for people, and we're not going to take any more, and you don't get any point of order, so I'm going to ask you to sit down right now, sir.
Record, though.
It is part of the record, sir.
And then procedurally, if there's any members of this committee that have been on the board of Planned Parenthood,
Sir,
committee of Planned Parenthood, I ask.
sir, I'm not going to entertain any more questions from you. I'm going to ask you to sit down so that we can finish our proceedings, okay? I'm asking you, if you find that there's a conflict, please seek legal remedy. We all have that.
Board members testified that he was on the board.
Can we get a marshal? Because I'm not going to keep asking people to sit down.
Just,
Man, I'm not, can we get a marshal? Because let me say this. Because I like decency and in order. There is no public testimony today. People had an opportunity to come back in the summertime and testify. The rule is the rule. We've had public comment. We're having public discussion right now. I'm going to ask you, please, no more outbursts from the audience. If you continue to speak out loud from the audience, I'm going to ask that you be removed. Is there anybody here who cannot agree to that? Raise your hand now. Thank you. Alderwoman Spencer.
I move that we, thank you, Mr. Chairman. I move that we pass Board Bill 34, Committee Substitute with a do pass recommendation.
Mr. Chair, just if I may, I am a board member at Planned Parenthood, which is a nonprofit board which I receive no remuneration from, no compensation from. It is a nonprofit organization. I do sit on their board, and it is not a conflict of interest for me to vote on this bill.
And, well, I'm glad you brought that to our attention, Alderman, but has that been cleared through the city council's office? Because that is a perception of a conflict of interest in my mind, because if you're sitting on a board of an organization, then you're part of their policy making, and
This
so.
is a public safety issue. This is not a conflict of interest. I will
Okay.
take that up with the city councilor before this goes to the floor of the
Okay,
Board
so,
of Aldermen.
so it has been fully disclosed that the Alderman from the 25th
Our
Ward.
rules only say that we have to disclose
Okay.
any potential conflict,
Okay,
that we do not
Alderman,
have to
I
recuse
got
ourselves
you.
as a
I
result
have
of
you.
it. Thank
All
you.
right, I kind of know the rules a little bit better than most of us down here, although I'm not perfect. So the Alderman from the 25th Ward has disclosed that there's a potential conflict of interest. That is on the record. There has been a motion to pass Board Bill 34 out of committee with due pass recommendation.
Second.
It's been second. Madam Clerk, please call the roll.
Alderman Vaccaro,
No.
Alderman Cone,
Aye.
Alderman Arnowitz, Alderwoman Hubbard,
Aye.
Alderman Kotar.
Aye.
Alderwoman Spencer,
Aye.
Alderman Muhammad, Alderwoman Boyd, Chairman Kennedy, Vice Chairman Boyd.
No.
4 aye votes.
Call the roll again, please.
Alderman Arnowitz,
Aye.
Alderman Muhammad, Alderwoman Boyd, Chairman Kennedy. 5 aye votes, 2 no votes.
Okay, by your vote, Board Bill 34 committee substitute comes out of committee with a due pass recommendation. We will be holding Board Bill 97. That concludes the Public Safety Committee. We are adjourned.